This is KTVO's Good Morning Heartland.
And welcome back. We've all had a bit too much to eat at times, but for some people, overeating or binge eating is a true medical condition. Today, we have Dr. Justin Puckett from Complete Family Medicine here this morning to talk more about binge eating disorder and what we can do to help those who may have it or maybe even prevent it. How are you doing today?
I'm doing well, thank you.
So first of all, tell us more about binge eating disorder or BED.
Yeah, binge eating disorder is actually a rather new diagnosis. It's something we've known about for a long time, but as far as it having strict criteria and being included in our mental health and behavioral book of diagnosis, something we call the DSM, it hasn't been there. But it was added a few years ago, and then that opened up the door for some further research. So to have binge eating disorder, one needs to do a couple different things. They need to they need to be eating lots of food, an unreasonable amount of food, and they also need to be doing it in a way that they can't control themselves. And then with those two things present, they also need to have three of the following lists. They need to eat much more rapidly than normal, eating until feeling uncomfortably full, eating large amounts of food when not feeling physically hungry, eating alone because of feeling embarrassed by how much one is eating during the binge, and then oftentimes feeling disgusted with oneself, depressed, or very guilty afterwards.
So how common is this? Is this more common in men, women? Do you see a similarity in both?
Well, in adults, it's actually the most common eating disorder. It's actually twice as common as both anorexia and bulimia combined. Whereas with anorexia and bulimia, we see a strong predominance towards women, usually in a 5-to-1. With binge eating disorder, it's closer to 2-to-1. So there are a few more women, but there's a lot of men included in this as well.
Now, what can we do if we suspect somebody that is having this disorder?
Well, recognizing it as a true medical condition is step number one. And then seeking treatment. And there's a whole variety of treatments. What's kind of gotten the press lately is we have our first medication that's been approved for binge eating disorder, and that medicine is called Vyvanse. Vyvanse is a stimulant-type medication that was approved first in 2007 for ADHD, something that a lot of parents have, it's approved down to age 6, and so a lot of parents are familiar with that medication. But actually, they showed that in the studies, whenever people use that medication to assist with the binge eating disorder, that they drop their binge eatings from several times a week down to, at the highest doses, even periods of having no binges in several weeks.
So what are the dose recommendations, and what are the side effects we need to look out for?
Well, unlike with ADHD medicines where we move a little bit slower in the titration, in the binge eating studies, they were pretty aggressive. Started out at 30 milligrams, quickly advanced to 50, and then if needed on to 70. And so that 70 is the maximum approved dose for either binge eating or ADHD. So we're a little more aggressive on titrating the dose upward on the Vyvanse there. The other things that we watch out for with the Vyvanse, it is a stimulant, so we have to watch out for dry mouth, palpitations where our heart's beating fast, feeling of jitteriness, and then because it is a stimulant, even though it's made in a manner that releases very slowly and has a low abuse potential, there still is the risk of dependency.
Okay. Now, what are some other options that we can look into if we don't want to be on Vyvanse or it doesn't work? What are some other things we can do?
Well, we've long used psychotherapy for this sort of a condition, and so getting some good counseling from somebody who's familiar with the disorder can be huge. And even if you used Vyvanse, it's something that in my clinic I would recommend that it be done in conjunction with. There are other medications that we've long used, some of the depression medicines, the SSRIs, and even medicines that increase dopamine like Wellbutrin. And then there are some other appetite suppressing medications that we've used over the years, Topamax, phentermine, some of those other more traditional weight loss medications that help to decrease the appetite, and by decreasing the appetite, you decrease the risk for binging. But remember, people who are binging often are binging even when they're not physically hungry, so simple appetite suppression isn't enough.
Okay. Well, thank you so much. And like you said, the first step into realizing that, first of all, it is a medical condition. We need to look out for the symptoms and signs and then seek help for it and hopefully stop it before it gets out of hand. So
absolutely.
What we'll do is we'll post everything on our website at heartlandconnection.com. We'll also link up Dr. Puckett's information with Complete Family Medicine if you have any questions or concerns. Again, thank you so much for coming on.
Thank you.
And we'll be right back.